to the Turing School interviews. Today we have the pleasure to have with us Luca Foresti, CEO of Centro Medico Santagostino, who played an important role in the task force for the creation and implementation of the national contact tracing system, Immuni. Welcome, Luca.
Hi, thanks for inviting me.
Okay. In the last months, there has been a huge debate about contact tracing systems worldwide and on the structuring of the diverse application at the national level. This has been in many cases quite complex and problematic as the system had to comply with privacy and data management criteria and rules and other issues. And today we are at the beginning of the second wave of COVID-19. We knew that it was arriving, and still the contact tracing system is regarded with suspicious by many. And so with this interview, we have the chance to ask Luca to better explain the functioning of the contact tracing and this kind of system. And in particular, I would like to start with the first question, which is to explain us about the scope and of this system and the functioning. So how this system works, both from a clinical and technological point of view.
Okay, let's start without technology. What contact tracing is simply to understand who got in contact with people that were positive in that moment. Why? Because the density of positive people among those contacts is much higher than the density that you can get choosing by chance in the population people and testing them. So that's the reason. Normally, since many years, you can do the contact tracing simply interviewing the people and asking them, what did you do yesterday, the week before, and so on. And given the information that those guys give you, to call other people and to ask them to be tested. So that is the typical standard. Now, what's the problem with this approach? That is still important and should be done, but the problem is that, of course, the memory of people and the ability also to understand who got in contact with them for enough time and close enough in terms of space is not so effective. Therefore, the idea that was developed, Immuni, was to understand the distance and the timing of those contacts in a certain way, to write down in a database all the devices that were around of positive people, and therefore to communicate to those guys, hey, you got in contact with a positive, therefore do something. Okay, this is the general idea. Now, when we started working on this project, we were much more aggressive on the project. So the idea was, for example, to use GPS and to understand where the people were and to have much more transparency on what happened. But the government decided, and was not the only one, I would say that the big majority of governments around the world did the same, decided to use a technology that was unable to understand who was the person and who were the contacts. So basically, what happened is that privacy was considered much more important of the health of people and the results. Fine, Immuni won a contest in the Italian state, and therefore was implemented in this way. Everyone can download for free in his mobile phone not all the mobile phones work with it, not because of Bending Spoons, the company that developed it, but because the government decided to use the Google and Apple stack. And those stacks are not working on phones that are older than a certain number of years. Let's say iPhone 6, for example, doesn't work. The download is for free. Downloaded, the person should only switch on Bluetooth, and from that moment, the system is scanning around for and looking for other Immuni app in the phones. If an Immuni app is found, then what happens is an exchange of codes that are anonymous. So you can't know who is the person that gave to your phone the code and vice versa. Those codes remain inside the telephone till the moment where a person is positive, so has a swab that is considered positive. And in that moment, the person can read on the Immuni a code, can send this code or to the, in Italy is called ASL, so is this organization of healthcare, or the general practitioner of the person. They put this code inside a software that they have, is called the Tessera Sanitaria, and this software upload that code in a central database. So the central database is, in this moment, having a list of codes of positive people. All the Immuni apps watch for the codes several times a day. If there is a code that was inside the phone, then it pops up the message, you got in contact with a positive. This is how it works. Okay, let's go on with other questions. There are many things that don't work.
Thank you very much for the answer. The second question is related to the fact that almost, I'm not saying all the countries, but many countries all around the world are using this kind of system in this moment. And so I suppose you have been studying and taking example, or anyway comparing different tracing system. So if you can tell us which are the main differences, because of course in Europe we had some, let's say, a diverse ether to arrive to the creation of the app, and in different states it has been done in different ways. So also the problems that emerge are different. So if you can give us an overview of the
It's very simple. There are two approaches. So one is the Italian one, and the second approach is to use GPS, and to use GPS for mapping the density of cases in the country. GPS was considered a problematic approach from a privacy viewpoint by many states. Therefore, for example, Germany is like Italy. Norwegia was a case with a high usage of it, but at a certain point, the country decided to close down the project because of privacy issues. In general, the percentage of download compared to the population is not so high anywhere. So in Italy, in the last days, we had a surge around 300,000 per day. It was quite good. I can also show you the graph, and this was a good news. But there is a bad news, a very bad news. If you take the number of positive cases in Italy, in these days around 5,000, and you calculate, therefore, given the number of downloads, how many cases should be inside Immuni, you discover that the number is 1 over 20, the real number. So we have a problem, we have a big issue. What is happening, I think, there are three possible explanations. The first explanation is that general practitioners are not uploading the codes, are not asking the people to have the codes when they are positive. And this is the most likely possibility. There is a second possibility, that is that those that downloaded Immuni are somehow different from the average people. So somehow are more protected, use more the masks, and behave in a better way. Therefore, they got sick less than others. There is a third possible motivation, the third possible ideas around it, that is that the downloads are not the same that apps that are active in this moment and are used. So we may see 8 million downloads, that is more or less the number as of today, but the real number are much less. I think that the main explanation is the first. So the government decided at a certain point to ask to 60,000 general practitioners to manage this stuff, to do the upload of codes. Italian general practitioners have an average age around 59. So their, let's say, proactivity, their ability to manage technology and other stuff is not so developed. And they were not trained for it. They were not, it was not explained to them exactly how to do it. Therefore, I think that the big majority don't upload it, don't ask to the people if they have Immuni, and therefore it doesn't work. There is one simple, very simple solution to centralize this in a call center, a national call center, and every time a person got positive, can read on Immuni a telephone number to be called. And second, I think that call center should also centralize the contact tracing, the human contact tracing. So the calling and the understanding of who were the guys met and so on.
Is it going to happen?
I don't know. I wrote to the two ministers on Twitter, and I have a few people I know in Rome, but they are into this political shit. They don't, I mean, they are not focused on solution of problems. They are focused on something else, in parties in a sense that five-star movements versus Democratic Party and so on. They can talk, I cannot talk to them, this shit. I mean, I hate that, but that's the situation. That's the reality.
Okay. So I have another question related to some issues that are very important for us, which are data privacy and the role of technical giants, so like Apple and Google, in this process of the creation of the use of the instruments that they have, and they are giants in this sense. So many people are still they have these arguments that they don't trust the system Immuni because they don't feel safe in relation to privacy, and on the fact that behind this system, this technology, there is this big part played by Apple. So I would like to ask you, can you explain us how does it work, and if we are safe in giving the data that Immuni is asking us, that which actually are not so.
Is a totally ridiculous line of arguments, and it's very simple to explain why. If you have a smartphone and Apple or Google want to get your data, of course they should do it hiding it, somehow not telling you that they are doing it. They don't need the Immuni for doing it. They do it. We use Facebook, we use Twitter, we use social networks and so on, and they are much more deeper in getting data from us. They use GPS, Okay, and with all those stuff, I mean, in Italy there are 40 million people using WhatsApp. What are we talking about? I mean, WhatsApp is Facebook. When Immuni arrived, Immuni is first the stack that Google and Apple developed by mid of May are the stack that is managing the exchange of Bluetooth information and codes. Then on top of it, Immuni is an application that is simply analyzing those data and sending. The only data that are inside it are this code. And let's think for a moment that a hacker get those code. What the hacker can do? Nothing. There are codes that don't have links with the names or location or anything with the people. So the issues that some people, politicians or even technicians are pushing on this are ridiculous. They're not even, it doesn't make any sense to talk about it. We should talk now about the surge of dead people, of care in the hospitals and so on. That's the important part now. Unfortunately, Italy is a country full of trainers, architects, and whatever. In every moment, each of us is very expert about something, and that's the situation.
Okay. So the last question is, I would like to ask you about a bit, if you can make a history of the creation of Immuni, because I'm curious about, as you mentioned, in some countries, the same creation of the app was too complex and they just decided not to implement the system. So what happened in Italy? Because we know from the outside, we know that there were many people and it has been quite complex, but I don't know,
no,
can you tell us?
The story is very simple. At the beginning of March 2020, looking at other countries, in particular South Korea and Singapore, it was quite clear that we had to, we as Italians, had to develop some kind of platform, technological platform for managing the information flow about COVID. Therefore, I started trying to understand who could do it in the best possible way in Italy. And I contacted two companies, Bending Spoons for the app development, because they are the best in Italy doing it, and Jacala for the geographical information system, because they are the best in Italy doing it. So my point was not if they were or not my friends or whatever. They were the best doing it. We at Sant'Agostino were able to analyze and propose the healthcare part. We are not technologists, but we work on healthcare. Therefore, I put together this team. And we started working without a client in mind, without understanding at the beginning where to go exactly. We simply started to talk, analyze, and work with 3 different groups inside the companies and developing something. And we developed a kind of platform that was quite already interesting and could do a lot of stuff for this country. But then the government decided to get out with an app, only an app. Therefore, in that moment, Bending Spoons went on alone, in fact, presenting the project of the app that was their part, and they won. And now we have Immuni. This is the story, nothing more, nothing less than this. Bending Spoons invested quite some time and people for developing it, and did it for free, always for free. We did it for free, and so on. There are no other stories more than this.
Okay. So thank you very much, Luca, for having touched some of the question about the contact tracing system and Immuni in particular. and thank you all for the attention.